monitoring is key to the management of ADHD. So using teacher and parent checklists and work samples and report card data are part of the American Academy of Pediatrics recommendations, and actually anybody else's recommendations. And placebo trials, as I mentioned, are very helpful. So why do you need to get them back? Well, first of all, to make sure you've optimized dose. Oftentimes in general pediatrics, one of the problems with ADHD management is the pediatrician starts a dose, the parent is delighted, things are better, and they say, come back in 6 months. Well, that's actually not the best way to do it, because that small improvement in behavior is not really optimizing where you could be. So managing medicine, especially initially, is really important. Again, why easy repeated televisits are good and why placebo trials are good. Then you want to be managing medication side effects, monitoring growth, vital signs, and especially sleep, and watching for the emergence of comorbid conditions, as well as setting behavioral goals for change. So we don't cure ADHD. I'm sure you know that by now, but you can set goals for change with ADHD, and that is actually one of the basic recommendations. CHADIS has goal questionnaires as well. But you also want to be watching the child's concept of themselves and the perception of the parents, as well as progress towards asset building. So making sure that a conversation about strengths and goals for building on strengths is part of the care of kids with ADHD.